So we're going to start our MuscleManTour on the muscles of the back, and we'll start with the deepest muscles here. So on the erector spinae group, we have the iliocostalis, the longissimus, and the spinalis. So basically these all kind of originate down here on the sacral crest. The spinalis group specifically originates more on the spinaeus process of the vertebrae. The longissimus originates on the transverse processes of the vertebrae, and the iliocostalis originates on the superior margin of some of these ribs up here. And they all kind of pull together and insert here on the mastoid process of the temporal bone. So their action, therefore, is to extend the vertebral column when it's flexed, and then it also provides lateral flexion of the vertebral column. Okay, and so on top of those muscles, we have the serratus posterior superior, and I'll just have to pull our latissimus dorsi muscle out of the way, and you can see our serratus posterior inferior. So these serratus muscles originate at the spinaeus processes of these vertebral columns here and insert on the ribs. And so what happens, so for the inferior muscle here, we get a depression of the ribs, so these end up pulling the ribs down. And the opposite up here, because they insert on these upper ribs, we will get elevation of these ribs. Okay, so the most superficial muscles on our muscle man, of the back anyway, are the trapezius and the latissimus dorsi. So the trapezius originates up here on the occipital protuberance, as well as the spinaeus processes of the thoracic vertebrae and C7 of the cervical vertebrae. And they insert here on the acromial process of the scapula. So their action is to, once they're flexed, is to laterally flex the neck. Okay, so the trapezius also acts on the scapula, since that's where it inserts. From a protracted position, the trapezius will carry out the action of retracting it backwards. Okay, and so the latissimus dorsi will insert here in the spinaeus processes of the bottom thoracic vertebrae and some of the more superior lumbar vertebrae, and then the insert on the intertubercular line of the humerus. So their action is to extend the arm, as well as provide a little bit of an abduction, and medially rotate the humerus. Okay, so what I think I was trying to say with the latissimus dorsi is that because it originates here on the spinaeus process of these vertebrae and the iliac crest, and then inserts here on the intertubercular groove of the humerus, this will help pull the arm inward, so adducting the arm from an extended position. It does actually help in like a rowing action as you pull down with the arm and use the back.
Okay, so the internal intercostals are the inside of the ribs. Their origin is the superior border of the ribs, which is up here, and the insertion is the inferior border of the ribs, and their action is to depress the rib cage when you breathe, which is the exhalation part. And then the external intercostals, they originate in the inferior body of the ribs, and the insertion is the superior border of the ribs, and their action is to elevate the ribs in this direction when you breathe. This is the serratus anterior, and it inserts on the medial border of the scapula, which is back here, and the origin is on the ribs 1 through 10. These ones. And its action is to abduct the scapula and to medially rotate the scapula and stabilize the scapula against the ribs so it doesn't flap up in some way. And then this is the pectoralis major. The origin is the sternal end of the clavicle, which is right here, down to ribs 1 through 6, and it inserts on the medial border of the scapula, which is back here. And its action is to flex the arm at the shoulder, and it rotates the arm medially.
Okay, so the next muscles I'm going to talk about are the deep scapular muscles. The first one is the supraspinatus up here above the spine of the scapula. It originates on the medial edge of the scapula and inserts on the humerus. So this aids the deltoid in abduction of the arm. The infraspinatus is below the scapular spine. It originates also on the medial border of the scapula and inserts on the greater tubercle of the humerus. So this will help rotate the humerus laterally. So the subscapularis, it's kind of hard to see, is underneath of the scapula. It originates also on the inferior medial edge of the scapula, anterior medial edge of the scapula, and then inserts on the greater tubercle of the humerus, which will actually rotate the humerus medially. Okay, so the other two muscles associated with the scapula and the humerus are the teres minor, which originates down here on the surface of the scapula and the more lateral edge, and then inserts on the humerus. And so the action that this will make on the arm is that it will rotate the humerus laterally. Okay, so the teres major inserts on the inferior angle of the scapula. Originates on the inferior angle of the scapula and inserts on more the anterior part of the humerus. And so the action that will do is kind of help to extend the arm as well as rotate the humerus medially. Okay, so the more superficial muscles on the back that kind of act on the scapulae are the rhomboid minor and the rhomboidus major here. So they both kind of originate on the spinous processes of these vertebrae and insert on the medial border of the scapula. And so together they downwardly rotate the scapula as well as adduct the scapula. The other muscle kind of acting on the scapula, which kind of fell off here, attaches up here, originates up here. It's the levitator scapula. So it originates on the transverse process and inserts kind of on the superior angle of the scapula, and this muscle works to elevate the scapula as well as downwardly rotate like the rhomboidus muscles do.
This is the pectoralis minor. It originates on the ribs 3 through 5, and it inserts on the coracoid process of the scapula, which is right here. It helps to press the scapula. It presses the scapula and it downwardly rotates the scapula in this direction. And then the diaphragm, which is down here, right under the lungs, originates on the xiphoid process of the sternum, and it goes up to ribs 5 through 10, and it inserts on the central tendon. And what this does is it flattens during inspiration to allow the lungs to expand to get more oxygen into your body.
Okay, so for the abdominal region, most superficial muscle we have is the rectus abdominis, which originates up here. Oh, sorry, it originates with the pubic symphysis and then inserts with the xiphoid process. So during flexion, you get a vertebral flexion here, like a bending at the waist. So you kind of pulls the thorax like down and forward. So deep to that, you have your external abdominal oblique and your internal abdominal oblique. And so the external originates on ribs 5 through 12, which are kind of like the lower ribs, and then inserts at the pubic crest. The internal will originate, so they kind of like come around and originate on the lumbar fascia and the iliac crest, and then they also all come down and kind of insert down here at the pubic crest. So the internal and external abdominal obliques are kind of wrap around here, and their action is to flex the vertebral column and compress the abdominal wall, as well as support all the abdominal organs in here. And the other abdominal muscle is the transverse abdominal, which comes across here and originates at the iliac crest, and as well inserts like all the other, or like the external and internal abdominal obliques down here at the pubis. So the transverse doesn't have any effect on the vertebral column. It'll just compress the abdominal contents here. Okay, so the next part that we're going to focus on is the brachium, the kind of muscles that act on the shoulder, or on the humerus at the shoulder joint. We have the biceps brachii, which has a long head and a short head. The long head originates on the coracoid process of the scapula, and the shorter head will originate on the humerus. And then it inserts down here on the head of the radius. So that will help to flex the arm at the elbow, as well as supinate the arm. The other muscle that helps act in flexion at the elbow is the brachialis, which originates kind of on the medial shaft of the humerus, or anterior middle shaft of the humerus, and inserts down here on the ulna. So that also provides that flexing motion. And then the last muscle that we have is the coracobrachialis muscle, which will originate also up here on the coronoid process of the scapula, and it inserts down here on the kind of medial middle shaft of the humerus. And this will actually help to adduct the arm. Last muscle I'm going to talk about is on the posterior upper arm, is the triceps brachii. So this muscle originates, it actually has 3 heads, but they all kind of originate up here on the humerus, and the longer head originates in the kind of the glenoid cavity up here, and then they all come down and insert in the olecranon fossa of the humerus, and so this provides the extension of the elbow. Okay, so on the anterior muscles of the forearm that kind of act on the wrist, we have the brachioradialis, the flexor carpi radialis, the palmaris longaris, and the flexor carpi ulnaris. They all kind of originate on the medial condyle of the humerus and insert on the carpal bones down here, which makes the wrist flex forward. The pronator teres originates up here on the medial condyle of the humerus and inserts on the radial kind of shaft, and so that will help to pronate the arm. The flexor carpi ulnaris has a special function where it will help to adduct the arm. Okay, so I just want to correct myself real quick. I was saying the right motion but referring to the wrong body part. The flexor carpi ulnaris, when flexed, will adduct the hand towards the body at the wrist, and then kind of in an opposite motion to that, or an opposing motion to that, the flexi carpi radialis, when flexed, will abduct the hand at the wrist. These provide the opposite motion of the anterior muscles. So on the posterior side, they mostly kind of originate on the lateral humerus, and then they insert down here on the posterior carpal bones, and so those will all act to extend the wrist. So the extensor carpi radialis longus will also help to abduct the arm. And once again, I said arm, I meant to say hand. Radius and the extensor carpi ulnaris will help to adduct the arm towards not the arm, the hand.
So this is the pelvic girdle, and some of the muscles on this one is the piriformis, the gluteus medius, and the gluteus minimus. The piriformis originates on the lateral surface of the sacrum, and it inserts on the greater trochanter of the femur right here. And its action is to rotate the thigh laterally when the hip is extended. The gluteus minimus, which is under, originates on the lateral surface of the ilium, and it inserts also on the greater trochanter of the femur. And it abducts the thigh this way, and it rotates the thigh medially. The gluteus medius originates on the lateral surface of the sacrum as well, and it also inserts on the greater trochanter. It abducts the thigh, and it rotates the thigh medially. This is the gluteus maximus, which is basically your butt. It originates on the posterior ilium, up here, down to the sacrum and the coccyx. And it inserts down here on the iliotibial tract and the gluteal tuberosity of the femur, which is over here. And its action is to extend the thigh, and it rotates the thigh laterally, and it also abducts the thigh. It is going this way, up. And then this over here is the tensor fasciae latae, and it originates on the iliac crest, and it inserts down here on the iliotibial tract. And its action is to flex the thigh with the hip, and it abducts the thigh, and it rotates the thigh medially.
Okay, so just a couple things that we left out today. The psoas major and the ilcus, which make up the iliopsoas muscles, kind of like your hip flexor. So the psoas major inserts on the transverse processes of the lumbar vertebrae, and the iliacus originates here on the iliac crest of the pelvic girdle, and they both insert down here on the lesser trochanter of the humerus. So what that essentially does is flexes the hip, and it also provides forward bending of the trunk when the hip is already flexed.
So this is the percutaneous of the leg. It originates right here in the pubis, and it inserts back here on the femur, on the linea aspera. And its action is to adduct the thigh, and it flexes the thigh, and it rotates the thigh medially. This one is the adductor brevis, and it also originates on the pubic bone, and it inserts back here on the femur, and it also rotates the thigh medially. This is the adductor longus. It inserts in the linea aspera of the femur, and it originates in the pubis, and its action is to help the leg rotate medially. And this back here is the adductor magnus, and it rotates the thigh laterally. Its insertion is back here again with the linea aspera of the femur, and it originates in the pubic bone. So these two muscles form part of the anterior portion of the thigh. The sartorius originates on the anterior superior iliac spine, and it inserts down here on the medial tibia. It flexes the thigh, and it flexes the leg at the knee, and it rotates the thigh laterally. The gracilis originates in the inferior ramus, and it inserts down here with the sartorius, and its action is to adduct the thigh, and it rotates the leg medially. So here we have the quadriceps group of the thigh. They all help in extending the thigh. And we have the vastus lateralis, the rectus femoris, vastus intermedius, and the vastus medialis. And they all come down towards the tibial tuberosity through a tendon. The rectus femoris originates up here on the iliac crest, and then these ones down here all originate across the intertrochanteric line, or the greater trochanter. And then back here we have the semitendinosus, which thigh, and it rotates the thigh medially, the leg medially, and it inserts on the medial tibia down here. And then this is the biceps femoris, which originates in the ischial tuberosity and the linea aspera, and it inserts in the head of the fibula, and it extends the thigh at the hip, it flexes the leg at the knee, and it rotates the leg laterally. And this, which is not here. Sorry. Also originates in the ischial tuberosity, and it inserts in the medial condyle of the tibia, which is right here. And its action is also to extend the thigh at the hip, and it rotates the leg medially.
Okay, so for the lower leg on the anterior portion, we have muscles that will dorsiflex the foot because they originate up on the lateral part of the tibia, as well as the fibula, and they all insert down here on the foot. So the extensor digitorum longus will actually help dorsiflex the foot, but it also extends the phalanges, your toes, 2 through 5. Okay, so the tibialis anterior will help invert the foot because it originates up here on the tibia and inserts kind of on the distal hallux. The fibulus tertius will help evert the foot because it originates on the fibula, kind of on the medial edge over here, and then inserts on the first metatarsal. Okay, so on the posterior side of the lower leg, superficially we have the gastrocnemius, and just below that you have the soleus. So the gastrocnemius and the soleus both kind of insert on the calcaneus, and when they flex together, they will plantar flex the foot. So these muscles are very active, kind of in jumping, running, walking. So deep to that, you have your toe flexors. They all originate here on the kind of proximal end of the tibia and fibia and interosseous membrane, and then insert on the distal phalanxes of the foot to get that plantar flexion.